Your teenage child has been diagnosed with functional neurological disorder, short for FND, after struggling for COVID infection for a while. Now, the question is, as a parent, is my child having FND or is it actually long COVID? Let's get to it. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and chronic pain survivor myself. My mission is to help teens and their parents resolve persistent physical symptoms such as chronic pain and FND so that they can get their life back and feel like normal again. Because I truly believe every teen who's struggling with FND and chronic pain deserves so much better in their life when they get their health back. If you're new to this channel, welcome, and make sure to click the link below to download a free PDF parenting guide on how to help your child at home who is struggling with FND or chronic pain. The link is down below. So today's video is about long COVID and FND. First of all, what is FND? I have tons of videos talking about what FND is, so feel free to check those out. But just to summarize a 10,000-foot overview of what FND is, it is an umbrella term to describe these cross-wired problems between your brain and the body when your body and the brain seemingly look okay. It is a legit condition and it is a legit disorder, so your child is not faking or making things up. It is a very common diagnosis in neurology clinics, and FND is a biopsychosocial phenomenon. It's not just one thing that is causing the FND or this one trauma, one anxiety, one stress. There is a lot more to it than that. I wish FND was that simple, but the truth of the matter is it is a biopsychosocial phenomenon. Now, I also have tons of videos talking about what biopsychosocial phenomenon is, so feel free to check that out after watching this video. So let's talk about long COVID here. According to the World Health Organization, they have very broad terminology to describe what long COVID is, mostly because we still don't know what it is. But here is what they say. They're basically saying persistence of symptoms that is lasting for more than 30 days post-infection of COVID. And they're also saying the common symptoms do include fatigue, shortness of breath, cognitive dysfunction or brain fog, in some cases motor and balance issues. I think this is where things get a little bit cross-wired between long COVID or is it FND. Now, how doctors are actually differentiating between the two is more of an interesting phenomenon. And there's actually a research study that came out recently from the UK talking about these two things. So let's look into what they're saying. So these researchers basically look at two different studies, one for long COVID and then one for FND. Specifically, there is a group of people who are trying to figure out the cause of the FND. So these researchers look at two different studies and sort of compare the notes between the two. Now, the problem with the long COVID is, as of today, this is December 2023, there is no clinically utilized test to confirm long COVID. There has been some cases of attempt to see whether high-resolution MRI and PET scans would yield such result, but it hasn't been useful just yet. So that leads me to the next question of then how these patients are being treated. Well, right now, ideally, according to this study, they're basically saying that integrated team approach is ideal. I would agree with that. For long COVID treatment, there's some study actually looking into antithrombotic therapy based on the assumption and hypothesis that long COVID has something to do with ongoing microvascular dysfunction. There are some long COVID clinics popping up here and there, but there isn't any definitive treatment based on this research study. For FND, on the other hand, it's been around for quite some time with so many different name changes, but within that, mainly the FND treatment is to work with FND specialists, such as psychologists. Not to say the FND is only a mental health disorder. Once again, FND is all about biopsychosocial phenomenon, right? But coming back to this, FND specialists includes psychologists, physical therapists, sometimes occupational therapists, or any other specialists that are out there who has been treating these conditions for quite some time. Now, the problem with the current situation based on this study is there are some misdiagnoses of FND for some patients without going through a proper test. And these doctors are basically thinking that FND is a pure psychological problem. Therefore, without proper test, they're sort of leaving their patients sort of hanging because, oh yeah, you have FND and it's a pure psychological problem, so go see a therapist. It is not a long COVID and you're not even eligible to come to the long COVID clinic. So these patients are sort of like in a limbo, right? And then sometimes on the other side, some patients are being misdiagnosed as long COVID without these providers having much knowledge about FND. Therefore, these patients are stuck in this long COVID clinic without much improvement from their FND symptoms. So I read this research article hoping that there is a criteria or guideline as to this is long COVID and this is FND. And at least from what I read, it wasn't the case. So which got me to thinking, what is missing here, right? So to me, the problem that I have, not with this study per se, but in general is, number one, speaking of FND, many doctors still believe FND is a pure psychological problem. Therefore, I have seen and heard so many times from my patients in my private practice and the families in my online program saying they don't listen to me and they think this is just stress. And these doctors keep asking their child, do you have a stress? Do you have a stress? Do you have a stress? To the point of the child's breaking at some point and saying, yes, I do have a stress. The fact that they're asking me that question about whether I have a stress is stressful, right? And so these families are feeling so frustrated about the fact that many providers are still thinking that FND is a pure psychological problem. The other problem I have with not about this study per se, once again, but just in general from my experience with so many families who's been struggling with this condition is many doctors are still trying to put this patient into one single box. So, for example, is your child having FND or long COVID? What if the possibility of having FND and long COVID at the same time? Sort of like your child can have broken bone and ulcer at the same time, kind of thing, right? So seemingly unrelated or seemingly related, but there is a possibility that your child can have both. So to me, it's a little bit more dangerous for people to think that it has to be one or the other, or chalking up to one thing to describe everything that's happening. And in my mind, from my practice experience, that as soon as your child gets a diagnosis of FND from a provider, whether it's a primary care physician or neurologist or other specialist, the best thing that you can do as a parent is to become familiar with what FND is, because not that many people know what it is until you sort of join the club that you didn't sign up for, which is the FND. And you are more than welcome. In fact, I encourage you to ask the provider how they came to that conclusion, right? Do they actually run the proper tests? What kind of tests are they? And how do they think that is the diagnosis for your child? Because you have the right to know the thought process that led to the conclusion of this particular diagnosis. The other thing is you can also have a second opinion to get a little bit more clarification of the diagnosis your child got if you feel there's something missing. With the caveat, there is also a possibility, and then thinking about the burden of this endless medical appointments for you and your child. And my thought is think about the priority, right? Absolutely important for you to have the clarity. You do have every right to do that. And at the same time, when it comes to the diagnosis of FND, the most important goal that you want to focus is on how you and your child can get back to fully functioning as much as possible, and hopefully as soon as possible. There's a study showing the sooner you can start the treatment, the better prognosis for your child. So why wait? If your child has been diagnosed with FND, then you are on the quest to find a FND specialist. Now, there are not that many out there, but there are some, and I do have a link down below, so you might be able to find a provider that you can work with. So overall, what is this study telling me? It's a little bit of like undigestive symptom, so to speak, if you ask me. Is it long COVID or is it FND? And then the study was basically saying, like, don't just assume that these patients do have FND without running a proper test. And in my mind, what kind of proper tests are we talking about? Because we don't even have the legit clinical test to confirm long COVID to begin with. So I feel like we have so much more to learn and to pay attention to what might be going on, really. But only time will tell. So as soon as I find any other articles or any studies related to this issue, I am happy to share that with you. Now, if you and your teenage child are ready to resolve persistent physical symptoms such as chronic pain and FND, then you might look into my online program, Teen FND and Chronic Pain Academy. Click the link down below to schedule a call to talk to me and see if you qualify for the program. Now, thank you so much for watching this video, and I will see you in the next video.